Good afternoon and welcome to this special session of the SACME Virtual Journal Club. Our topic today is skills and best practices for submitting your scholarly work as abstracts. We have envisioned this session as one of those that will be helping us build a capacity within the society in this important area of scholarly work. My name is Mila Kostic, and many of you know me as the facilitator and the host of this journal club. So before I introduce our presenter and my co-facilitator today, I just want to remind us all of the format we have been using for this journal club. So about half of the time will be devoted to the formal presentation, and then the rest of the time, the remainder, about half an hour, to your commentary, to examples, to questions, and to really an opportunity to learn with and from each other. The ways to engage in this conversation are two. You may either raise your hand. So if you see the icon on your dashboard that looks like a hand, and if you click on that, I will be able to unmute your phone and then call your name, and you will be able to speak and everybody can hear you. The other way to engage is to type in your question in the question section, and we can then read your question out loud, and in that way, or commentary, in that way, give you a voice in this discussion. So without further ado, let me now introduce our primary presenter, Dr. Sanjeev Sockalingam. Sanjeev is a psychiatrist, and he's the Vice President of Education at the Center for Addiction and Mental Health in Toronto. He is academically a professor in the Department of Psychiatry at the University of Toronto, and he also serves in some very important roles as currently in SACME. So he is on the current board of SACME as a Canadian regional representative, and also heads a subcommittee of the scholarship committee, a really important one, and that is the state of the discipline. Joining us and joining me in particular today, I'm thrilled to welcome Christine Flores as a co-facilitator. Christine is the Administrative Director of Continuing Professional Development at Oregon Health and Science Universities. She also serves on the board of SACME as a Western Region rep, and she's on several other committees, Communication Committee, and hopefully soon Scholarship Committee as well. So with that, I would just like to turn this over now to Sanjeev for his formal presentation. Thank you.
Thanks, Mila, and again, thank you for the invitation for the Virtual Journal Club. It's a pleasure to be presenting on this, and particularly I think it'll be of interest for those who are considering submitting abstracts to the SACME annual conference, but also more importantly to think about scholarship and ways to disseminate scholarly work through conference presentations, whether it be poster or oral presentations. So pleased to talk about this, and I have to say a lot of this will be some general framework and general pearls, and also probably most importantly shared experiences, as we often learn some of these skills about after applying them in our own settings and to conference submissions. So I'm looking forward to the discussion. All right, so I'm just going to get the slides going. Here we go. So I have no conflicts to declare, and really what I hope we can cover over my short presentation and over the course of our broader discussion is to take a look at scholarship, how it relates to abstract submissions. In this context, obviously the SACME abstract submissions. We'll talk about general approaches to preparing abstract submissions, what things may need to be in place, how we can better position ourselves to submitting abstracts. I'll go into a bit of detail with some of the online SACME abstract submissions and just talk about some key points to think about, talk about some of the common challenges with abstract submissions, including some personal reflections, either in my role as an abstract submitter or with abstract reviewing, that there are some certain challenges that often come up with abstract submissions and how we might mitigate them, and then we'll just summarize at the end. So I think probably the most important point is why bother submitting abstracts to conferences? I think abstract submissions that result in oral presentations or posters are an important part of scholarship in CPD. And scholarship in CPD, as we all know, and as many of us working in CPD, that is an important part to advancing our field within the broader health professions education. Our goal is to think about ways we can continue to evolve and demonstrate impact on learning with the end goal of preparing healthcare professionals for practice and improving patient outcomes. I think that's one of the kind of core components, and scholarship, including abstract submissions and presentations, are key. Many of you probably know about Ernest Boyer's 4 domains of scholarship, but I'll just review them because you'll see some alignment with some of our SACME abstract submission and presentation calls. So we have discovery, integration, application, and teaching. Discovery is really what some people might consider that original research, basic research, although that term basic is in quotes because it does encapsulate a broad range and different types of research. It really focuses on what is not yet known. And so those may be things within health professions education and CPD, where maybe it's looking at the development and validation of a specific assessment tool for providers post-CPD, to look at identifying factors that might motivate someone to participate in CPD. It might be a quantitative study or a trial comparing the efficacy of 2 different interventions and understanding the impact of those interventions. It may also be qualitative in uncovering new conceptual frameworks that can be used to further advance additional research in CPD. So there's a broad range within discovery, but definitely there's a clear research question that focuses on generating new knowledge. Integration is really the expansion of knowledge through connecting multiple disciplines, looking at sometimes outside of education theoretical frameworks and applying them to an education context. It aims to create discourses that give us a deeper meaning of the state of literature or research. It really is focused on what do the findings mean. Common types are systematic or scoping reviews that often look at a range of literature to bring together a synthesis or analysis of the state of the literature. It can also be taking a different lens, which may be, for example, implementation science, and applying that to CPD and thinking about how, for example, the implementation of an education program was undertaken using an implementation science theoretical framework. And then application is really about that bridge from theory to practice and generating new knowledge. And so this focuses on how can new knowledge be responsibly applied to consequential problems. This may be, I can think of one personally where a program of CPD like the ECHO model, which Project ECHO, and how it's being applied in different contexts and settings. So the application might be using a model that's based on theory and conceptual frameworks and applying it and evaluating its outcome. And that's different than, say, finding new evidence for the efficacy of an intervention. It's really about the application in a particular context, or bringing those best practices into the education context. And then lastly is teaching, and teaching is transmission, dissemination, or co-construction of knowledge. And so how can the knowledge be accessed and understood by others? These can include a range of types of scholarship activities that focus on faculty development, different instructional methods that can be used, maybe even simulation and debriefing could be an example, and really looking at how to better translate those that knowledge base to providers or our CPD attendees. And you can see that in our types of submissions, for example, our research in continuing medical education, oral presentations, or RCME, oral presentations, are likely to focus more on discovery, integration, and to a certain degree application, whereas our best practices in innovation and education technology innovation might be more along the lines of integration application or more so application and teaching, right, as you think about these. Not to say that you may not have some components of discovery, but in general, these are where we see some of the different types of scholarship fitting within these categories. And the poster session, as people who have attended the SACME conference would attest to, covers the broad range of these 4 domains of scholarship. So again, the rationale for disseminating CPD research and innovations at conferences is really we want to start to help each other advance and disseminate key findings and practices so we continue to grow the field. You know, CPD is continuing to adapt as the context changes. It helps advance CPD research and practice in our own work. And so I know for myself personally presenting at conferences, just listening to others' presentation and being part of that dialogue can help inform my own research and practice and what I'm applying in my own setting. An opportunity to obtain feedback is another rationale for disseminating CPD research. So things may be a work in progress or the first iteration of a program. And so really getting feedback from peers can be quite critical. I've had this happen as well, and I know it's quite common that going to conferences, you might see people doing similar work and identify potential collaborators or potential students or trainees who might be engaged in participating in that line of research. It can help with spread, so people might hear about some of those ideas and want to think about how they might apply it, and you may take more of a support role in implementation and spread of that particular program. And then lastly, there is this notion of kind of advancing our own scholarly career and profile by dissemination. Again, it's, I think, an important part of being a CPD scholar is that dissemination piece. So I think often people have a difficulty getting started. You know, what should I think about or start to conceptualize in terms of my abstract submission? So it's really important to identify what might be important or significant for a topic of an abstract. And for research, I think for many of us in research, it's hard to kind of go back and conceptualize a research activity. Often you're thinking about a research question, you're basing it within the evolving literature, or you have a program of research. But there may be times where you might have an interesting research question from data that you've collected that you could conceptualize and form and ask as you're gearing up for an abstract submission. Otherwise, another way to think about conceptualizing or getting started with an abstract would be to look at your own CPD practice and the range of activities, whether it be your existing research activities or education programs or innovations in your practices, and think about, are there components that you've collected some of that data or information in some repository? Are there in the early stages something you can share or disseminate? And again, we'll come to some of those themes in the abstracts in the following slides. I think one of the critical components is to ensure the topic in question is embedded in the literature. So I think one of the common pitfalls is thinking about a novel program and describing it. However, it may not be explicitly stated how that program was formed or based on or expanding on the literature. And that applies to research, but also best practices, because they're often rooted in key theories or learning theories or conceptual frameworks. So I think that's an important point. And throughout this process, you'll hear this in the next few slides, is looking for mentorship and feedback, both in the early development stage of where you're going to focus in an abstract, or is this program something I should explore, but also as you're starting to develop the abstract submission itself. And I think one of the keys is it's always more fun, I think, and probably more rewarding to think about, are there team members who've contributed to the program who may also want to contribute to the abstract development that could be enthusiastic team members as part of the submission. and then start to hone in on what type of abstract that you're going to write, and we'll get into that shortly. So I think as you're writing competitive research conference abstracts, this is for research conferences, but I do think it applies to best practices as well, is identifying a key purpose or goal or aim of the abstract or program or area of research, and describe it very clearly. I think it's important to know your audience. So for SACME, the reviewers will be people with experience in CPD, and so how is that going to be relevant to CPD and advancing CPD and for potential attendees? So thinking about audience is important and tailoring it appropriately. And you want to have that balance between, introducing core concepts that inform programs or the area of focus without getting too much jargon in there that it starts to either confuse or, for people who are less familiar, make it difficult to interpret. And then really staying true to that structure is important, as that's how the abstracts will be graded, and we'll talk about evaluation shortly. So I'm going to go through each of the types of SACME abstract presentations and just illustrate some of the key components. I will say this is available on the SACME website, so I encourage you, and we also have attached it in the webinar itself. But the research orals or RCME orals really can fall within one of 5 categories for the SACME conference. So works in early stages, and so I want to encourage people to think about this, because it's not one that people often consider, is that if you are starting a research project but have yet to have data, often people will say, I'm not ready to convert this into an abstract. But I think within the SACME community and attendees, it's often a great opportunity to get some early feedback in a formal presentation. Specifically, if you have an area of focus, research question, and some methodology, you might get feedback on that methodology or ways to approach it from attendees at the conference. So that's one type of RCME oral. There's works in progress where you might have some preliminary data, some experiences about implementing that research that you might want to share or disseminate, or some early unexpected results. There are completed studies, and so for those who have published papers or those that have been accepted for publication, those can be presented. We've talked about integration as a type of scholarship, and evidence syntheses, such as review papers, would fall here. And then there may be papers that would fall under the research orals that might be describing a new research methodology or way to conduct research in CPD. And so that would be another one that would fall within this category. And I won't go into a lot of detail with the anatomy or the structure of these research orals, but again, the title should really reflect the key terms of the research. I want to spend a moment just talking about background. That I think one of the challenges are within the word count, how do you get across the context, the so what statement for your particular area of research? I think it's important to provide a little bit of literature review and that gap, but also to ensure that you situate your research question succinctly is key. And again, having a clear research question is important, and we'll talk about do's and don'ts later. In the methods, describe how the study was conducted, the data collection and analysis. There is not a lot of words, so really analysis might focus more so on the types of analyses that were broadly conducted, as opposed to much more detailed analysis that might go into an actual publication. And your results should focus on the key primary outcomes and those salient findings. And then the conclusion or the impact should be the so what. How will what you found influence current or future CPD practice? And I think that's a good way to think about that so what impact of the research. Second, or best innovation. And so here we see the application component. And again, you're seeing it line up with some of those types of scholarship we just talked about, of applying research and theory for a variety of fields. So it doesn't necessarily have to be in CPD, but into a CPD context to talk about the goals, issues, and practical problems that would be of interest to CPD researchers, providers, and practitioners. And again, It also aims to facilitate learning from practical experience. So it's another way of kind of advancing the field of hearing about the outcomes of implementing a particular best practice in one CPD context. So there are some themes each year, and so in 2020, here are a few of the themes. I'll highlight change management. I think more and more we've been seeing within health professions education, but especially in CPD, given the systems context and the aim to improve or change practice, that change management is a key component. So those may be things about related to leadership, leading change, implementation of change in organizations. So those would be one theme under best practices. There's applying the science of learning and teaching, and so this comes back to that teaching scholarship component. We've seen a growth in QI and practice improvement in CPD, and again, thinking about how certification processes have evolved, that's a key and important driver. Teaming for quality and safety in CPD is another one, and then assessment and evaluation methods for CPD. So again, thinking about best practices and how those have been applied in a CPD context. And again, within those best practices, you might see projects where there are programs being implemented which may have outcomes related to behavior change or learner improvement or reflection that could fall within best practices and innovation. So again, a similar type of abstract structure for that. The problem statement, again, is the focused question or the aim. Approach, this would be describing more about what actually was implemented or what you did. And then really the essential outcomes are the results or findings. And there are sections for barriers and facilitators to implementation, but we also have that impact or so what statement at the end. The education technology innovation, I think this has emerged as a category for abstract submission at SACME. As many of you are probably aware of or reading already, the growing number of research articles and documents outlining the potential for technology in medical education and early implementation. And there are probably a few trends, use of technology to deliver CPD, and so how can we use technology to increase access to CPD activities, whether it be through virtual online communities, virtual reality, if it's for simulation to make it more accessible, or through kind of new online methodologies or platforms. There's a use of technology to enhance teaching or assessment, so maybe using technology to provide more feedback or to embed it within existing teaching and curricula for providers, or to provide assessment and data back to those individual learners. There's a use of big data, AI, or artificial intelligence and predictive analytics, so thinking about how can you predict kind of practice improvement, linking to electronic health records and using that as kind of a big data source for CPD and both in evaluation but some iterative professional development and improvement. And then CPD may also have a critical role to improve effective integration of technology into healthcare. So as technology advances in how we deliver healthcare, our providers are going to need to be trained by that. So you might even talk about or submit an abstract that might be related to programs that are focused on building that capacity in healthcare providers. And so these are the themes here: digital innovations in CPD, using simulation in medical education, where simulation is the technology, driving change through data analytics. So examples of that are programs that are using that already, and then harnessing big data and AI in CPD. So similar to that, those big data sets and kind of that deeper learning that might occur within those data sets that might inform future learning for providers or CPD programming as a result. And then the poster session, again, is a facilitated poster session, so there is a brief oral component to it. And those of you who might be submitting oral presentations, it may be accepted as posters. I think the added unique challenge, but also opportunities that posters provide, another opportunity to provide, in addition to, say, slides or the presentation itself, a visual of how you might want to display your best practice or research outcomes. And again, this is a nice way to also disseminate scholarly work equivalent to oral presentations. And again, the criteria are somewhat similar for both oral and for poster presentations. So this abstract evaluation criteria is applied to both types of presentations. And so the SACME peer reviewers will be looking at clarity of that purpose statement, which is why I focused and highlighted that. I think it's important to highlight what is the actual aim of the abstract submission or the scholarly work, really articulating the relevance in the field of CPD, and that could be by situating the current state in a brief one sentence or two in the introduction or background, but also in the impact as well. If it's research, we're looking at the quality and appropriateness of the research methodology and also the feasibility of the research if it's a kind of in progress. And then we're also looking for the potential for impact for advancing science and practice. So things that are linked back to having a kind of significant impact for the broader range of CPD or CPD providers is really critical. And so that will also be one of the rubrics for scoring the abstract submissions. So just have a table of do's and don'ts. This is by no means comprehensive, but things that, again, personally, my own lessons learned, but also being a reviewer in various conferences. I think one of the don'ts, I would say, it's really easy to think about as you're delving in the literature, thinking about how you're applying a research or best practice, that you really want to showcase all the literature that you've read, and so the background becomes a bulk of the submission. I think the challenge there is really what abstract reviewers are looking at is that you cover the whole gamut of methods, results, and conclusions in sufficient detail. So you don't want to get caught in front-loading with the background literature, and you really want to articulate that methodology, the important results, and the impact or so what statement. The other component is one that we commonly see as well is the general or vague aims or research questions. And I put an example there. Our goal was to deliver a CPD program in diabetes. I think the challenge there is not to know what that delivery, what was being evaluated, what was the actual kind of outcome that someone was looking at. So really being specific about the goal or question and how that builds on the literature. So maybe reworking that to our goal was to compare provider satisfaction and engagement with the frequency of audience response systems, right? So that is a very more specific or clear aim, and so you can walk through what the actual procedures were, what the results were in relation to this aim, and how it fits in the literature and impact. And then using simple descriptions of methods, right? So you could say, for example, a don't would be, we used a survey to assess perceptions. You might want to briefly describe, components of that survey, how long it was. Again, knowing that word count is always a limit, but providing enough detail to get a sense of the extent of that survey and what particular key domains, not every item, but key domains that might be used. So really providing more detail on that collection analysis is important. And then in the impact, restating the results and outcomes is probably not enough. What people are really interested in is how is this relevant to the literature? What's the unique contribution to the CPD field? And so you may speculate it or might identify an area of future research, but that is an important contribution as well. So really kind of shifting from just restating those results in the impact or kind of final component of the abstract and focusing on the relevance and unique contribution. So overcoming potential challenges, one of the most important ones is, take a look and see with the working idea that you've generated, are you in the right classification of the submission? Is it a best practice? If so, is it a general best practice, or is it in technology, or is it a research component? Try to think about your elevator pitch. How do you briefly summarize your study and project and then start to build that out in your abstract submission? I always am a firm believer of getting feedback early. So if you have an idea, if you have a team that's going to be putting together abstract, kind of toss it around for some ideas and feedback. If you are working on something in a smaller group or on your own, think about maybe reaching out to within the SACME networks, maybe regional reps or others that you might know from SACME. We can discuss that in further detail. And then after submitting and kind of writing up the abstract, and once it's in, if by chance you don't get accepted in this conference, I would say don't give up, because it might be an opportunity to develop further or to update. And I would say if you can, reach out for feedback on the abstract submission. Maybe after a period of time, I know for myself, getting it back and looking at the abstract after time has passed, I get a sense of, oh yeah, I would have maybe added this component or made this modification. So sometimes that can be an opportunity to reflect. And again, it's an opportunity to create the abstract for this conference, but also revise, resubmit to a future conference, future SACME conference or other education conferences as well. So I just will end there by saying that, disseminating research and innovations is a crucial part of us, of our CPD field, and it's how we advance our work, share our work, and start to spread our work. Consider that all different types of scholarship, they're all valued in the kind of conference presentation, dissemination frameworks and categories. And so think about that as you're constructing your SACME abstract. Again, use your networks, including SACME, to obtain feedback, how to improve your abstract at all the different phases, whether it's early on, as you've got your written abstract draft completed, and afterwards, depending on outcome. And then I would say critical is grounding the abstract in some kind of theory, literature, or evidence, and it doesn't have time to get a sense of how this will be building on kind of existing work or research or innovation. All right, and I will end there. So thank you.
Great. Thank you so much, Sanjeev. Thank you for really distilling this down for the group, for all of us, and also for providing those pearls from your experience, which I know is extensive. I was hoping, and I know this is how we envision this session, that now we will hear from all of you. So if you have been thinking about a question or an example of something from your experience in submitting an abstract for SACME or something you considering, or another conference, so this is hopefully applicable to a broader practice of this scholarship component and not just SACME conference. The timing, as Sanjeev mentioned, we tried to time it so that, as you know, the call for abstract for SACME 2020 conference is up and open until August 15th. So we hope that this will be helpful to all of you, and that maybe we can now learn from your experience and something that you can share with us. So I invite you all to raise your hand if you'd like to provide a commentary or pose a question, or type in a question or something in the question section. As while we wait for questions and comments, I was reminded, as Sanjeev, you were talking about Boyer's classification of scholarship, made me think of an editorial that many of you, I'm sure, can remember. It was, for me, a very memorable one that Kurt Alson did in JSEP. Trying to remember, I think it was 2011 or 2012, 2011 probably, when he talked about the need for scholarly practitioners in CPD. And he contrasted this scholarship of discovery versus scholarship of application, and talked about how it's often overlooked or thought of that innovation resides only in the research arena, and that the practice is often overlooked because scientific evidence contribution to changing practice is overemphasized. And sometimes we miss that tacit, personal, practical knowledge that's really needed to deal with the realities of the practice, and how valuable that is in building the scholarship, the body of scholarship in CPD, and how we don't have enough of that. So it is an open invitation to think broadly about what innovation really is in terms of practice, and how the scholarly practitioner in CPD really is drawing from and contributing to knowledge base at the same time. He talked about some standards, which Sanjeev talked about as well in considering this. And there's no way to overemphasize that really having a clear goal, being adequately prepared, meaning developing and understanding existing scholarship and building on that, using theory and conceptual frameworks to ground your presentations in and your projects in, and then taking systematic approach, meaning mindfully selecting methodology, being explicit, and inviting critique, as again, was already mentioned. So I do see that we have a couple of questions now. So we would love to hear Christine's experience in developing abstracts, deciding what to submit, and how it all went. This is from Marcy. So Christine, would you tell us about your experience?
Sure, I'd be happy to. Thanks for the question, Marcy. Good to see you online on the webinar. So as some of you may know, I have been in the CPD community for about 4.5 years now. And I think my first SACME conference was 3 years ago. And I was excited to see the call for abstracts go out, and I sat down with our team to discuss the things that we were doing that we were particularly excited about, that we thought were novel, that we wanted to share with the community. A little bit like what Sanjeev was talking about, we wanted to get a discussion going and hear what others were doing in those areas. So for me, it was a great opportunity to think about the things that I really wanted to get feedback on. So I wasn't in a position where I had a big longitudinal study or anything like that. I was more in the best practices category, which has been very helpful. As far as the process of developing the abstracts, again, to really echo what Sanjeev was saying, we put it together, we got feedback, we did a couple different iterations of it before we submitted it. And I do have to say that it was a really fantastic experience. I was really nervous about it. It had been really the first time I had submitted scholarly work to a conference, but I was pleasantly surprised by really the welcoming attitude of everyone at SACME, and people came up to me not only after the presentation, but during the whole conference, just to talk about the work and encourage me. And I think it's really helped me feel more confident in gaining those skills and really trying to take it to the next level. So I really would encourage anyone who is a little bit hesitant to just give it a try. It's one of the things I've really loved about SACME is how welcoming the whole group is and how much feedback in a very constructive and supportive way they're able to offer.
Thank you, Christine. So I have to apologize. I have, by accident, deleted a couple of questions. I know Stephanie, I think Sophie had one. So Sophie, would you mind if you are somewhere where you can talk, if you raise your hand, I can unmute you? Or would you mind retyping your question then? I really have to apologize. And I'm trying to remember who was the other person who posed the question. So yes,
Cindy.
Go ahead.
I see a question from Cindy Juarez from Texas Tech. And it's, what kind of research can a smaller CME CPD program undertake with limited time and resources?
Good question. Do you want to take that on?
Are you referring to me, Mila, or to Christine, or?
Either one of you.
I'll just provide some commentary to that. I think it is a significant challenge because I think a lot of people are interested in and have a kind of desire to participate, initiate, start research initiative or research project in their CPD program. It does require some resources, but I think I would take a step back to say that probably the best approach would be what kind of scholarship can a program do? Because there's a range of things which everyone's talked about that I think sometimes research questions can require a bit of resources to do some of that analysis or data collection. But there are things we do on a day-to-day that are part of practice that through a specific lens or framework, we can get new insights into practical challenges or outcomes related to implementation or inform how we can spread things or how they might be adapted in a specific context. So I would say look at, for me, I'd look at my own program and say, if, there's something that we're already doing, maybe it's something related to our technology, for example, that could be assessed or evaluated in some way that could be more in line with a best practice, which is an equally important scholarship opportunity.
And Neil, if I could just add a little bit to that, I think one thing that we've done at our institution is to try and be creative about forging partnerships. So we don't have a formal school of education here, but we do have something called the Educators Collaborative, which hosts both formal and informal networking opportunities. And I've been able to find some support at my own institution as I'm developing research questions or looking at ways to present data. That's been very valuable. And another thing that I found really useful with having low resources in our own division is to reach out across our national network. So I did a co-presentation with actually Cindy Juarez from Texas Tech. And that was a great way to sort of take the resources that we both have at our schools and amplify them because they were different. So we were able to kind of complement each other.
Mm-hmm. Mm-hmm.
That's
an excellent point. Yeah, great point. Also, I think that the best practices really lend themselves to thinking broadly about the innovation, as I mentioned, and what it is that, especially if you're a small office, I know that there are problems that are difficult to tackle, and whether it's even in the criteria for accreditation, scholarship is one of those areas, and so people sometimes struggle thinking through where can we apply this, and if it's not SACME, there might be regional conferences where you could present your work. But think about what is unique. Each one of us and each one of our programs have something that we're especially proud of, whether it's a particular topical area that you're tackling or methodology of teaching or learning or something that's technology assisted. Many of us are doing simulation these days. Communication, teamwork, many of us are thinking interprofessionally. All of these are potential areas to think through. The next question comes from Sophie. So I appreciate this. So Sophie's asking, do we have any recommendations for the best way to include references on a poster presentation? She would be interested to hear our thoughts, or everybody's thoughts, on how to balance findings and references visually. So if I may start, I was reminded when I saw your question, Sophie, about this thing that was, from what I understand, blowing up the internet on the topic of poster presentations. And now I cannot remember what it's called, but it's a guy who, somebody will remember, who thought through the conundrum of, lining up posters in a poster session and the confine of, 2 seconds or whatever a person has as they zoom by the posters, and how it's difficult in the sea of content that's normally presented on a poster to actually grab for that important piece. So if I remember, it's really been some time since I thought through this, but I think it was the idea was to go into 3 sections and start with results or so what question, and maybe do very bulleted, very big findings. Why does this matter? And that's the key component. And then working backwards from that, so that the background and everything else and methods and results would be the something that confirms or supports the findings. I really like that approach. So when you think about that, the visual appeal of the poster is really one of the things that are very unique to poster presentations. So when you think about, so that's the part that I just wanted to contribute, and obviously putting in references, you don't want to put too many. But what about Sanjeev? Do you have any comments?
I mean, I know the one you're talking about as well, because I think it went across social media. So I think I think we all.
Yeah, do you remember what it's called?
I don't remember. Let me just see here if I can find it. I think there's a YouTube video about it. I think I can send the link around. Maybe
that would be great. Somebody sent it
chat
to me a while ago. Yeah.
But I think it really depends on the type of conference, because I do think some conferences are still limited in terms of their structure or what they propose. So I think you do have to look at the format. So you may not be able to get away from a reference list in the traditional sense, but I would say, for education posters, provided that it's not specified, my principle has been, I think it can be a little bit hard visually, and also result in decreasing your font and increasing the word count by listing all references. So I would say general approach and things that we've done in general with colleagues have been to summarize maybe the top few references. You could also, as a handout pinned to your poster, have a reference list if you so wish, to minimize the clutter on that poster as well. So the strategy would be to keep the core references that inform the work on the poster, but I think you may also want to supplement that with a more comprehensive reference list. And a lot of people are using kind of QR codes and things as well to further disseminate some of their work, and so you may have more leverage that way if you want to build that out. So I would say simple references if you can, and then maybe provide an addendum or a separate handout with a full reference list. But I will try to send out that YouTube video as well about how to create a better research poster.
Yes, thank you. And Laura actually sent us a reply to look at Twitter for hashtag better poster.
Okay, so, there we go.
There you go. So I just shared that with the group. Laura, do you have anything else? I see that you raised your hand.
So, I just didn't know if you had seen that, and I was going to tell you it was there. And actually, part of the layout of it includes a QR code for people to go to for further information, so you're not cluttering the poster itself.
That's right. Thank you for that.
Mila, I'm just thinking that in itself could be another abstract submission, right? How to make your
Yeah, really, the methodology of how to.
There you go.
There you go. Laura, did you want to contribute anything else?
No, I think that's it.
Thanks so much. Okay, so we are looking for volunteers to contribute your thoughts and experience in submitting abstracts or questions for anybody online. There are 31 people online, so I know this is of interest to all of us, and I know there's a lot of experience and knowledge in this group. So should I call on somebody? Let's see. I see Nancy Davis is joining us. Nancy, would you be comfortable if I unmute your phone line?
Can you hear me, Mila?
Yes, we can hear you. Go ahead.
Okay, because I was having some audio issues, so I wasn't sure.
Sorry. We hear you perfectly.
Okay, well, you really caught me off guard. I was not prepared to say anything. So I guess my only words of wisdom would be to really not be afraid to submit something. I've done several things in best practices and works in progress. And I have to say that the SACME community is just so helpful and generous and not judgmental or critical in any way. So it's really been helpful to me, and I know to many others, in presenting in these forums to get that feedback and help, especially when you're presenting a work in progress or something that you're pretty early in the early stages of. So that would just be my feedback.
That's very good comment. Thank you very much, Nancy. I think it's very true that I think many folks have used this as an opportunity to maybe be on the front end of a larger project that then ends up as a publication. And so the feedback that they've gotten and questions through the oral presentations or during a poster have really been helpful. I'm looking for more volunteers, and I see, let's see. Mary, are you somewhere where you could talk? Mary Turco? And would you be okay if I unmute your phone? Mary has led these efforts for several years together with Betsy. Mary, can you provide some pearls of wisdom?
Mila, can you hear me?
Yes, we hear you. Go ahead.
Okay, hi. I just wanted to say hi and thank you to everyone who's both organized this and delivered this virtual journal club, but also are participating. I think the only thing that I would like to say is pretty much to echo Nancy's comments that one of the scholarly responsibilities that SACME people think about is how to help people become more proficient in doing scholarly work. So people are really hoping that people will submit, and that if they have questions or concerns about the quality of what they're doing in advance, that they reach out to somebody on the scholarship committee and let them know, and people will get back to them and give them advice or information similar to what Sanjeev was doing today. That's historically been something that the scholarship committee has done. So I would encourage people who have never submitted an abstract to do one, or to reach out to somebody and ask for help, and make it a goal for this year to submit and to follow through and see what happens. And then I think for those of us who are always looking for tips on how to do it better, both for teaching how to do it and also for doing it yourself, that chapter in the CPD book is fantastic. The one that Mila was just mentioning, as a help to people. And there certainly are other resources. So I would go to the book and take a look at that and proceed from there.
Thank you, Mary. So the CPD book chapter that we are referencing is, I believe, chapter 12. Tanya Horsley did, co-authored with, I want to say, it was Stephanie. And so that certainly is helpful. And then Betsy and Kurt did another chapter later on that is invaluable as well. And there are resources for scholarship at the back of the book as an addendum. We have another question. So thank you, Mary, for your comments. I appreciate that. We have another good question from Rob Martin, who's asking something that oftentimes we all thought about. So he's saying many times the poster idea comes from looking back over programs we've done, and then we realize, gee, we wish we structured this differently to yield data for CPD research. So any advice on retroactive data gathering strategies? I I have to say that I think everybody's been in this conundrum, and my 2 cents would be to not force something that's not strictly research into research. It's difficult when something is not conceived with a research question at the front end, to then force it into strictly research. But if there is a good project that you can submit for a poster or something, or an oral in best practices or technology supported innovation, I think that might be a better go. But I'm going to let Sanjeev maybe comment on this more.
I would agree. I think you can do retrospective research, but usually there's a research question that kind of forms from literature, or you've kind of heard a presentation and it's situated something that you're doing in a new light. But I think the challenge is with retrospective studies is that often you may be limited by the data that was originally collected, and you may not have all the data you need to answer that question. And to Mila's point, I think in that case, if it's retrospectively looking at outcomes, for example, that might align with best practices in the sense of, are there ways in which you are using one of the evaluation frameworks or implementation kind of approaches to see how you were able to look at implementation in your context and the impact of that outcome in your context. And that way, you may not have all the data, but you might have some data that gleans some insight about some of the challenges or successes of the implementation in your context. So again, we can all learn from that, and it's valuable to disseminate in that context as well. So I agree with you, Mila. I think it's hard to force it after the fact, unless there is a question and you happen to have that data available to answer that question. But otherwise, I would think more about the implementation piece and how you're applying those best practices in your context, and that we could learn from that, from the available data that you have.
Yeah, I would just like to add that, that at least our organization, our society has really grown in terms of recognition of the scholarship of practice in CPD, and even in very practical ways that can be seen. Just because if you look back, many years ago, we only had RCME awards, and that has changed. So we now have awards recognizing best presentations in best practices, best orals, but also posters, and several other awards. So I want to give a nod to Mary and Betsy for instituting those, and also David Wilger last year for implementing additional awards. So that just really shows how much value is placed by our society on these types of submissions. So we have a commentary from Martin, who says, "Thank you, Sanjeev. Very informative virtual journal club." I would certainly agree. And we are getting close to the end of the hour, and I don't see any additional questions or hands raised. So unless I'm mistaken, I would like to give an opportunity, first of all, to Sanjeev and to Christine to provide any final comments they may have or conclusionary remarks.
Christine, why don't you go ahead first? I'm happy to go after.
Sure. I just want to, again, try and encourage anybody who is even thinking about possibly submitting scholarship to do so, and a reminder that the deadline for the 2020 SACME annual meeting is Thursday, August 15th at midnight Eastern. And I'll personally say, if you have any questions, you can reach out to me and I'll either help answer or connect you to someone who can. Thank you.
Great.
And I would just want to just reiterate that abstract submissions are a great way to kind of put your foot in the water for research and scholarship if you haven't done it before. And SACME, as many have said, is a great community to try it out in, as you'll get great feedback and support along the way. So I encourage you, if you're thinking about it, and to take that dive in, and there'll be lots of us around to help and support.
Thank you so much. I want to thank Sanjeev for his terrific presentation and guidance and experience in leading us through this webinar. I want to thank Christine for her wonderful co-facilitating and informative and experiential thoughts. I also would like to thank all of you for joining us today and spending an hour of your time with us, and for your interest in obviously working through SACME abstract submissions. I'd like to, before we break, just mention that we will have another session this summer, as I promised. So it looks like August 30th will be the date. Stay tuned. We will officially confirm that soon. Hopefully, it will be another session in capacity building, scholarship capacity building. This time, we'll take a look at the skill of peer review as a peer reviewer. So if you can, it would be great for you to join us. And if you can't, as you know, all these sessions are recorded, and all of you will have access to the recording on the SACME website. The fall schedule for the Journal Club is in the works, will be announced soon as well, and we will continue to work through the chapters of our book. And what's left is to wish you a lovely afternoon and a great summer, and to thank you again for joining us. Bye-bye.